In this video, I'm going to show you how to access the NASCO IV trainer with an IV and pressurize the system to make it ready for IV infusion validations or competencies, whatever your college calls them. So in that bag, there's a couple different things. The IV trainer is used for phlebotomy as well, so there's fake blood in there. We're not going to use the fake blood. We're just going to use distilled water, which I have over here. A couple bottles of that. In that bag, you're going to have your arm. You're going to have these two bags, and that's really all you're going to need from that bag. So I won't show you the rest of the contents in this video. All right, so first things first. So they're going to come kind of wrapped up. I've already been playing with these, so they're open. And what you want to do is you're going to clamp both sides first and foremost. Okay, and there's connections here, right? So input, output, left side input, right side output. Doesn't truly matter, but to keep track of everything, it just makes better sense. If the arm cup came right out of the bag, it's going to be less pliable at the end, so it's going to be a little harder to get your tubing connected easily. So what I do is I just run it under warm water for a few seconds, and it loosens it right up. So I've already done that, and I'm going to connect. So input on the left, okay, output on the right. Right, both sides are clamped. There's a clamp here. It's pretty hard to get all the way clamped. A couple of different settings, and it's a large bore, so you really need to make sure it's all the way closed. So both bags. So what I'm going to do is I'm going to fill this to about 500, because what I want to do is I'm going to pressurize the system first. Okay, this is completely empty, no fluid in it, no fluid, no fluid. Add distilled water. It's not going to go anywhere because I'm clamped, right? But what you want to do is you want to pressurize the whole system, okay? So what I'm going to do is take this side down, the output, unclamp, okay? Bring it over to the sink, just in case it leaks a little. And I'm going to unclamp this. Now, like I said, it's a large bore, so it's going to go pretty fast. What I want to leave in the system is about 200 on this side. So I'm going to go until about 200. We'll see how that works. Open the clamp. Okay. And you can kind of see it going through the system. Very important, make sure there's no bubbles. As you can see coming out here, there are lots of bubbles. So that's going through all the tubing in there. You want to get rid of all of that. Once you are bubble free on the output side, you know you're pressurized. You can definitely damage the system, the tubing inside, if you don't get rid of the bubbles all the way. So you want to make sure you do that. Okay, so I'm starting to go pretty bubble free here. All right, so I'm going to clamp this side at about 250. I'll give it, just for the sake of measurements. Clamp 250. Okay. And over here, you don't really see anything, right? But what I'm going to do is I'm going to bring it down because I like the visual of having some fluid on this side. Unclamp. Right. And we'll go about, let's see. Oh, gravity help us. Getting some bubbles coming through again. There's no exact science to this. It's just when it's bubble free, you know you're good. Right? Looking pretty good. Tiny bubbles are fine, but you just don't want those big, big ones. Okay, so all my fluid's on this side now, right? What I'm gonna do is I'm just gonna fill this up. You want your arm nice and pressurized while you're accessing it, so you can get that flash when you put the IV in. So, unclamp both sides. What it will do is it'll even out completely when it's open on both sides. I don't really care about evening out, but just to tell you. All right, so I'm gonna clamp my output. Okay, I'm just gonna lower that in case it's not completely clamped. Okay, so I'm just gonna look at my input bag and see if it's moving at all. And it looks pretty good. Unclamped, not moving. That means we clamped our output bag good. This is how you pressurize it, okay? This is how you get a flash in your IV, because you have the pressure from here that's going to, once you're in the vessel, the pretend vessel, that's going to give you that flash in the chamber. Okay, so for supplies here for accessing, you need a catheter. It needs to be a 20 or smaller, so I have a 22 here. You don't want to use a large bore unless you're specifically training for that, because it will kind of ruin the arm a little faster over time. Your extension set, a flush. I like the transparent tape, sticks a little better to the mannequin, and a Tegaderm. Okay, you don't need to really skin prep anything. Mannequin's pretty tough. Okay, so it is a little harder to access the mannequin than it is a real person. I'll tell you that. And the veins look superficial, but they're more deep than you'd expect. So we will attempt, and it doesn't matter which way your arm is. It could be, we could do the posterior aspect, we could do anterior, whatever vein you think is most appropriate. All right, so I'm gonna flush this first. Just wanna prime this, just like you would in a real person. If you forget to prime, not a big deal. Okay. All right, so we're gonna pick a vein that will be easy for the students to manipulate when they're connecting their IV bag. Let's see. The arm is pretty stable like this. Go from the side. I think that would be pretty easy for them. Okay, and then you'll start seeing a flash. So you have to tamp it onto the system. So what I'm going to do is, before I pull my cannula out, I'm going to get nice and ready here. Okay, tamponade, just like you would in a person. Okay. Okay, then you go ahead and connect that. Give her a flush, and you're all set. So you just tape it up. A little transparent tape, okay? And that's how to access.